So welcome to this session on success lies in Broca's area. Do Google up Broca's area to find where it is. Communication pearls in ophthalmic practice. This has been a long-running, successful program, and it does give us an insight into what communication skills are required both for PGs as well as for those in the big bad world of practice. Without further ado, I request we reshuffle the order, but since you don't have the order, it doesn't matter. So I request Dr. Madhav Ambekar to start the ball rolling. Madhav is a successful practitioner in Jalna, from Jalna in Maharashtra, to tell us about how to tackle unhappy patients.
First of all, I thank the organizers as well as KP also to incorporate me into this IC about the success lies in Broca's area. But then finally, there is always in the current context, we have been seeing that the unhappiness amongst the patient is increasing for manifold reasons, that everybody starts feeling that whatever you are doing is finally just to make money. But then there are situations that we need to tackle them in such a precise way that how to tackle the unhappy patient, because first and the foremost as a basic that we need to understand that you cannot make everyone happy every time. So there are at times situations that whatever best possible, even the patient may have 6 vision, but then patient will keep saying कि साहब थोड़ा सा पानी आता है तो कभी लाली आती है and blah blah. So effectively that even goes as an unhappy patient. So always remember that it's never 100%, but we try to reach to the near accuracy as much as possible so that the patient becomes happy. So making the patient happy is finally an entire teamwork. So everyone in the chain is equally important, because it starts right from the your housekeeping services, the front desk, the people, those who are the patient care attendants, then the optometrist, consultant, and the people, those who counsel the patient finally, and then patient goes back, whatever prescription you give or whatever advice you give him. So that entire team is equally important, and one improper link in the whole system will make the problems for everyone for that matter. So let it be a small practitioner, a group practitioner, or a corporate hospital. Sometimes they can make you cry like anything also. So as I said, the staff, it needs a right person for the right job, and which should have a communication skill, because many times you must have seen that the housekeeping staff may say ki, they may keep on blasting ki, nahi, wahan ye mat karo, wo mat karo. See, finally there are ways to communicate to the patient that what you should not be doing and how you should be doing. Don't spit it over there, don't smoke, don't throw the litter, and so on. But then they keep on, because probably at the end of the day they are also tired of telling the same thing time and again. So they are likely to shout at. So they should have a compassionate ground, a soft spoken person, and a receptive for the person, what are his or her needs are there. So effectively it is always better to be receptive, which will help them to probably solve most of the issues that before they are in their mind as FAQs, they should be able to solve those issues. And for most important that whatever has happened, the person should be there to accept the responsibility. There are, you must have seen कि सर ये मैंने नहीं किया, उसने किया होगा, ये उसने वैसा बोला, फिर मैंने ऐसा किया. So effectively it needs a constant staff training also to make the patient happy, so that they accept their responsibilities very clearly. And what makes the patient to visit you again, if unless the patient is happy, he will not visit, he may not recommend. And especially in the current context when the newer generation is always there for the Google reviews, so we should try and our level best. We also know that the Google reviews can put in by yourself through the various contacts and other things. But then if you want a natural flow to occur of the all these reviews, it is always better that how the patient becomes happy again, that your attitude, then your interactive skills, the well-mannered staff, the cheerfulness of the hospital. Sorry, there are many situations we must have seen that there may be a litter, the housekeeping staff may not be very attentive and all those things. So effectively, see, like what we have been seeing at this mall also, that whatever, I mean this convention center, that whenever we are there, there is hardly any litter overall. So that means the housekeeping also makes us very happy. So each and every link, as I said, that is equally important, and a patient should feel that he is getting a proper attention. Let it be anyone, any person for that matter coming to you, let it be VVIP or whatever may be the case, but patient is patient. There are at times situations I have been telling to even the VIP patient that you may be a very high-end politician, you be minister, but then see that you have come with your wife, or you have come with your for yourself, or you have come with your son, but then you keep out all those feelings that you are a minister or whatever may be the case. That only will make you a good patient. So we have to be very polite while saying to that very critical people, So a better communication skill, first and foremost in the communication, is that you should be a good listener. You must have seen many times that the doctor, ye aisa karo, waisa karo. But then finally, what is his requirement? What are his complaints? That needs to be understood first, and beyond that, you start talking to him. And that's the most important part. That good work will give you a good repute, and for that, you have to be soft spoken. That is most important. That you have to have a compassionate ear to listen what you have been told by the patient during the first visit. The You should get a feeling of connect, and probably with most of the people even in Mumbai, they know that they need to speak good in Gujarati, because there is a lot of Gujarati crowd in Mumbai. So effectively, as most of the us will agree on this statement, that whatever you communicate properly in their mother tongue, without putting a very high end technical words, that would give you the best connect. And then the patient will always feel that yes, you are listening to what he has spoken to you. And for that matter, then you need to avoid attending any phone calls unless it is dire necessity. See that you don't attend the phone calls. Focus on the patient's issue. Do not have any admin issue in between. Keep on coming. And it is not that the chair time, इतने टाइम में इतने पेशेंट खत्म होना चाहिए. Probably this is something which we need to understand as of now also, that everybody there is a mind and a soul inside that body which has got a disease. So to cure that disease, probably a good communication and a good ear without looking into, because I have seen the doctors that, in fact, there was a fellow who used to start a stopwatch. Finally, there was a very wise fellow who is a retired professor from one of the colleges. He said, sir, if you are putting on this stopwatch, probably then I better that I go out of your consulting. I know that I am a doctorate in some subject of physics, and still if you are putting a stopwatch that I should stop early, I think better that you continue with your stopwatch and other patients, I go out of your consultancy. So he was a neurologist from some place. So whenever sometimes you have to give some extra time. Normally, see, 95 to 98% of the patient will be cleared within a regular time period. But then always see that whatever extra small time is there, don't look ki yaar isna iska time ho gaya and then we need to close down that particular patient because then now there is a huge queue. So hardly 2% patient would need extra time. And to continue properly, the counseling becomes the main crux of the story. So it is the most important. So never put on the stopwatch as this has happened. Get yourself trained to reach to the root cause of the complaint. And you are primarily, see, always I had come across a fellow who is a glaucoma consultant, and he was crying, saying, glaucoma wale patient itne aate nahi hai. I said, primarily, you have started hardly 3-4 months back. And how you expect a patient knows that he has got a glaucoma unless someone has diagnosed that he is a case of glaucoma? Because he comes with, say, diminished vision. Your optometrist would say ki chashma ka number le lo, this is the case, and blah blah blah. But then finally, unless you explain him that you are likely to have glaucoma, this is glaucoma, and for that you need a glaucoma basket investigations whatever are required, and then only he will understand what is glaucoma and what is the problem. So unless you reach to the root cause, nothing will work for you. So then, because of your proper counseling, patient would get a perfect confidence for you, and then there are more chances that he will come back to you. But the most important thing, as I said, that first you are an ophthalmologist. You may be a retina fellow, glaucoma, cornea, or whatever may be the case. Unless you are attached to some major institutions where everything is scrutinized before the patient reaches you, because there are many occasions that many of us are working in a smaller to medium setups where there is a assistant people, those who are there, but finally patient wants to see the doctor also. And for the refraction of the bifocal correction, all those things, many times the doctor ignores the patient very badly. So we need to understand that aspect also. And for that matter, a doctor has to be socializing also, and not on the current context of the social media like things, because social media can be a supportive thing, but it is not the exclusive thing, because finally you need to have a human connect. because patient is a human being and you need to have a human connect. The social media will give you a general connect but not a human connect, and for which you should be in a smaller towns, just have anywhere for that matter a sort of a smile of recognition. Try to remember the name. There are few details that patient may remember all this still. Habit of making the small notes into your own software which will be seen by you and visible to you only overall. And a specific problem with the patient, if you remember, even if you feel that my daughter is there, she has a problem, you can just ask her. That's the only thing. So there are two aspects about the technical and commercial counseling. So this is the point that all these things are there. So technical counseling is to be done by always as consultant, and hyping out of the outcome is to be avoided. Spectacle freedom and spectacle dependence will be less kind of a thing in the multifocals and trifocals EDOFs. And because the more amount is paid, there are more expectations. And then confirm about the patient and the relatives and so on effectively. So, and then the breaking the bad news is another thing, that when should you break the bad news is the only point where you are coming out of the theater and patient's relatives are highly receptive. There you can always break the bad news that whatever has happened. And immediate post-op is the best time. Dilute the story, but at the same time, make them to understand everything, and assertive but meaningful. Thank you.
Thank you so much, Madhav, for a fairly comprehensive overview of how we can tackle and prevent these patients. I request Dipti to introduce our next speaker.
Next, we have one of eminent speaker. She's from MAMC, GNEC, a very wonderful teacher who is always into the teaching to the postgraduates. And today she would be talking about how to teach communication to postgraduates, a world when PGs examine patients before us. So that's very important. The first step where the patients come into contact with remains happy moment for them too. So teaching communication to in PG ophthalmology, how to inculcate it is what next she would be speaking on. Over to you, Kirti ma'am.
Thank you very much for this IC and this interaction, because even though I know the audience is very few, that's enough. It's just a few minds which are needed, and the bright sparks are needed to set the fire going. Can I have my business cards? नहीं, ये नहीं है. हाँ हाँ चलो आप
No, she's going to go next. No problem.
Your lecture is also very interesting, because after this, if you are talking,
No. They're both on same topics, PG communication. So then I said, do one after that, then I'll talk.
it's 2:20 तक मुझे time मिलेगा.
देख लो. डॉक्टर कीर्ति का कोई है? डॉक्टर कीर्ति
उधर से नेटवर्क से मंगा लो फिर. So they will speak after you.
They will both speak.
No.
So how many of you, however little they are, how many of you actually are into teaching postgraduates? Can I have a show of hands? Okay. You people are pretty young. how do you think the PG training and the teaching or the communication skills have changed over the time when you were PGs? Till I get my slides loaded, can I have a feedback from you youngsters? You are now teachers. When you were PGs, how have things changed according to you? Is it same? It's not the same. Why? Do other PGs same towards you as teachers as you were to your teachers? Okay. So my question remains unanswered. You think it was the same? No. What do you think is the basic in just maybe one or two couple of words or one or two lines? How do you think the PGs have changed? Okay. No, I'm talking about the attitude, the communication, the type of respect they give you, courtesy. Less? Huh? Missing. So if in a power equation, please, thank you so much for that feedback. In a power equation where Dr. Quresh is senior to me and I'm junior to him, and where I'm not able to give him request, in the power equation when the patient needs me desperately, how do you expect them to give respect? The power equations also show you what the training is. Somewhere we are at fault in training our children, I feel. As parents, somewhere we have defaulted. That is why our children, but the thing is not only children, it is the attitude of all the people. Isko beta, how do I go forward? No, it's not working. Yeah. Okay. So at our time, I'm so Sir Quresh sir and me have gray haired, and Madhav is little less gray haired than me. Yes, it was the doctor is the second god on earth. That's no longer the truth. Absolutely not the truth. But it is not working at all. And each time if I can't do this, my time is going to be deleted. बच्चे इसको ठीक कर दो ना पहले. What's the point? ये नहीं चल रहा, ये देखो.
66.
इसी से चलना चाहिए, इससे चलाऊं मैं. इससे नहीं चल रहा था ना. Okay. So they are shifting equations. And so much so, we heard the horrific incidents 2 days ago, I believe it was.
Yeah.
And there are many such incidences. There is no dearth of them now. They are increasing. I work in a medical college where almost every week the students have an incident to share, the interns have an incident to share, and that was truly horrific. So, what is the reason? The second fact is we are ophthalmologists, we are surgeons. When you look for ophthalmology on the Google or any search engine, you find these videos, you find these images. That is the image doctors, especially ophthalmologists, are known by. All our focus is the skill training on technological and surgical aspects. How many surgeries have you taught me? How many phaco surgeries can I do? How many ECCs I can do? How many trabs can I do? How many strabismus I can do? As you said, it's all quantity of surgeries, which is seems to be the goal. And this is actually true even in the syllabus. The effective domain is said on paper, but how many of us really teach it to our students? Initially, yes, the surgeons had a horrible time because the era before anesthesia, they were supposed to be focused on fixing problems and don't be in connect with the patient. But empathy and putting yourself in the life of a fellow creature who might repose a confidence in your surgical knowledge, as you call it, can we put ourselves in our shoes? We are at least 5 ladies here. We've gone through labor, we've gone through delivery. When you were delivering your child, do you remember how you felt when you were as an intern and treating in the labor room? You understood firsthand what it means to be in pain. You understand firsthand what it means to be at the mercy of a doctor. You had no control of your bodily functions. You are at the mercy of somebody, and that's what the patient who's undergoing a surgery feels all the time. And as this movie showed very beautifully, in fact, some parts were very true. Audio was.
We are not here to make friends. मैंने अपने 25 साल के करियर में किसी पेशेंट से दोस्ती नहीं की. किसी पेशेंट का दर्द महसूस नहीं किया, सिर्फ उस दर्द का इलाज किया, and I've done well. I do not love my patients. Confused? Let me explain. इस हाथ को देखो, rock steady. हजारों ऑपरेशन किए इन हाथों ने, लेकिन ये हाथ कभी नहीं काटे. लेकिन अगर मैं मेरी बेटी का ऑपरेशन करूं तो ये हाथ जरूर काटेगी. क्यों? इसलिए कि मैं मेरी बेटी से प्यार करता हूं. पेशेंट से दोस्ती, हमदर्दी, लगाव एक डॉक्टर की कमजोरी है.
So this is what we've been trained to do actually. This is just telling you what he says. And he doesn't say it totally wrong. If you're totally emotionally attached to the patient, nobody can be a good surgeon. Very few people can operate on their mother and father. There are some who can, most of us can't. So yes, that's a very valid point. However, it takes it too far because human connect is being eroded by this removal of the empathy. And this is a true story from AIMS, this so-called Premier College, a documentary film named Placebo. In 2014, an MBBS student in AIM punched his right hand through the window pane, damaged his nerves during a drunken incident. His brother stayed in the hospital for 3 months to understand how it was done and to get him cured and get him treated. This 3 months went into years. The brother stayed. No one outside detected this. People living in the same quarter detected that somebody was there with him. So this is this unseengness or the numbness in this premier college. So the talisman for all this is communication and effective communication at that point. What is effective? You speak the same language. Today I am in Kochi. I should know Malayalam to speak in the patient. I don't. So how will I communicate? You have to learn the language. However, that is the verbal communication has some barriers, but non-verbal communication transcends all barriers, and visual communication is the most effective. It totally transcends all barriers, as shown very beautifully by this child who wants to pick up the rabbit in the statue who feels he has fallen down. So all verbal communication, and we are eye surgeons, we go by visual clues. Verbal and non-verbal communications are very easy for us. Then why is it that we don't pick up the body language? As Milton Erickson talked about it when he had polio and he was stuck in the bed listening to his parents talk about his illness, he devised this body language. And some of you may remember the long time back Charlie Chaplin, who never, the person of the silent films, who talked everything without any words. So emphasis on body language, emphasis on non-verbal language, that is how you can effectively communicate with patients. And that's what we have to teach our students, because, and also as parents. This beautiful sculpture, which won the award in 2019 from Amsterdam, depicts something which is now called as phubbing. That on the phone, all of us are victim to it. We want to communicate with other people on the phone and not communicate with the people sitting next to us. I'm also a party to it. All of us are. And this is actually an addiction. So what is the solution? Is empathy, not sympathy. What Bhumani Rani was saying was sympathy. Ki mera haath kaapega because I'm in love with my mother or father or my daughter. Empathy is you can understand what they are feeling. It's a detached concern, and it's a primarily cognitive content. It's an entirely learnable behavior, and we devised the empathy sensitizing module in our hospital, and we've been using it for 5 situations. We tried to do that initially for amblyopia therapy, for advising laser treatment for diabetic retinopathy, corneal donation, grief reaction, glaucoma medication adherence, and prescribing glasses to a child. And these were the students who were taught, the undergraduates were taught to do a good empathy doctor and a mirror scene with a poor empathy, with a dominant non-caring style. And the postgraduates were observing it. And this tool of ours has been used since then. As students, we tell them, read this book, do that, skill mastery. In addition, please do tell them how to deal with failure. Tell them that transference will happen. This is a brick kiln which is brand new. It has done no work, and now this brick kiln has done a lot of work, has made a lot of bricks, and therefore it is dark. So you will absorb some pain. That's natural. So nothing to be scared of transference. Resilience is important, because as this beautiful picture which won the Pulitzer winning prize showed a malnourished girl starting to reach the UN feeding center, the man adjusting his lens to take the right frame of her suffering might just as well be a predator, another vulture on the scene. This gentleman, Kevin Carter, won the Pulitzer Prize, but he committed suicide after this article appeared in the New York Times. So what am I telling you this is because whenever we teach communication skills and empathy and sympathy, you tell them to be resilient, and transference is going to happen. There is nothing to be scared of transference. This is a very famous clip from Patch Adams.
What are we so mortally afraid of? Why can't
I think we'll skip the film.
decency and God forbid maybe
Yeah.
even humor?
Okay, so he just says that
Death is another. Why don't we want that in a patient-doctor relationship?
there would be some failure.
And I believe they're wrong. A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's why.
And we all talk about quality of life now. Please remember there are two sides of the coin. As we as teachers, are we so industry driven that we are following the Pied Piper of Hamelin and only talking about skill training and not communication? Mimicry is the best way of adulation. All our students do mimic us, and when they mimic us, they see some personality of a doctor, as Picasso saw this long ago. But now what is happening is that these role models are actually missing. When we ourselves don't walk our talk, then how do we expect our students to learn communication skills? And that's the last slide. Students, when they enter medical school, they come with a lot of idealism, but when they leave medical school, they're already cynical. Maybe we are at fault, so we need to understand that. And the audio clip was playing, Kora kagas tha ye man mera, likh diya naam usme tera. We need to actually introspect when we talk about communication to the patients, to the students, because we need to do it ourselves, and we have to teach the students all these things. Thank you.
Thank you, Dr. Kirti. And to carry on in the same vein about the mishaps that can occur with poor communication skills amongst PGs, request Dr. Dipti to give her talk. Sorry. We're really cutting down time. 2:30 have to conduct the quiz. क्या हो गया? Sure, okay. Yes. Yeah, go ahead. You can ask a question.
Yeah, no, not a question. I just thought as they're getting ready, I just thought I'll bring two quotes which come to my mind about communication. George Bernard Shaw said, the greatest problem with communication is the illusion that it has been accomplished. And the second thing is, war begins when words fail. So these two things we should try
Absolutely.
and remember.
Both very relevant. Yeah. I'll do them. Okay. Okay. Muscati. Over you.
The most difficult situation can sometimes be diffused in our OPD just by a small amount of wit and humor within us as doctors too. To do this, to take away this topic, we have with us the doyen in the field of ophthalmology.
Session is around here.
I think
This is yours?
we have Dr. Kuresh with us.
Over there. Preview में डाला था. 12:30. No, 1:30. नहीं हाँ मस्कती today all the presentations is making a mess. Yeah, folder मस्कती कोची ये folder खोलो sense of humor ये चौथा Okay. Thank you. So without wasting much ado, because I would like all of you all to reach Leva 1 at 2:30 for the quiz. Why is it necessary to have humor and speaking skills? Because understand that many times as you grow older and get more white hair, many patients are coming to you for a second opinion. Many times they're coming because they've been frightened by all the things that the person who has given the first opinion has told them. And sometimes the patient will be frightened by what you are going to tell them. So there is a lot of fear and anxiety in a patient's mind when he comes to a doc. He's come to you because of some problem. So they need to be put at ease. They need to be more receptive to what you're saying. And in the initial phase, there is nothing which separates you from the person down the street. Zero, because you have no experience, you have you're unknown in the area. What will set you apart is your speaking skills, your communication skills, so that the patient will go home and say, this person had a lot of time to talk to me. When I started my practice, I had a competitor who was 30 years my senior and immediately related to me, my father. And he had everything going. He had appointments stretching for 3 months. And I just bribed the secretary, so the secretary would tell the patients that if what are you coming for? You're coming for glasses. Go to this young man. He will spend minimum 30 minutes with you, because I had no other patient. Well, if you go to the senior, he will spend only 2 minutes. He is charging you less. So these are your skill sets. You're charging less. You're got enough time. So make use of those assets. But mainly, your speaking skills will come in first before your surgical skills become known. Explain with examples so that they understand. So come down to the level of the patient. He's not an ophthalmologist. Sometimes we overdo things with our high-tech software, and we have TV screens which show them cataracts and we show them all. They're not following. So give them simple examples. I tell them the eye is like a camera. The retina is like the film in the back of the old film cameras. And if it's somebody who's above 50, I tell them you will understand. And the person who's 20, I said, you may not understand. But in the old days, we had cameras which had film at the back. The film which was the back, that's called retina. So you get a little chuckle from the senior person straight away. So you can use models, color atlases, but the visual imagery that you come out with, there is a lot of scope to put in humor there. Please don't tell patients jokes because they think you've got extra spare time. So there is no joking with the patient. The humor has to be subtle and just come through in your body language and in what you speak. Let's take a few examples. Doctor, is my cataract ready for surgery? Simple question. Now, you don't know whether the patient has gone to somebody else who's already told them that by today evening, 7 o'clock, if you don't operate, 8 o'clock, your cataract will burst. 6/9 vision patient. So he keeps quiet about that. He comes to you, is my cataract ready for surgery? So you keep in mind that somebody may have told him. So you say, you do have a cataract and that's causing your disturbance in vision. Are you ready for surgery? Is it causing you much handicap? You know, if you were Mr. Mukesh Ambani, I would have operated you today evening, because signing $1 million checks, if you make a mistake in the signature, the government will fall. So then I tell him that, however, if you're Mukesh Ambani's mother who reads the Gita in big print, she can easily read. I won't operate her for 5 years. So I've put him at ease. I've used humor. It has been subtle. I've told him that most patients are between Mukesh Ambani's mother and Mukesh Ambani. And you can choose whenever you want, whenever it disturbs you, we'll operate you. Will you be doing my surgery by laser? Or you will be doing my surgery by laser? No, that is a question. So you don't have femto, you don't have robotic, all that, this thing. So what do you tell him? You tell him that almost all surgeries in the world are done by a process called phacoemulsification. But because the word is very long, And many people trip over the pronunciation. They don't use such long words to scare you. They use simple words like laser. I will be doing exactly what the person who says that they are doing by laser. That is, I will be without any stitches. In a short span of time, your cataract will be out and a lens will be in. You're not telling him any lie. You're just telling him that you're downplaying the laser part. It's of course different if you have a femto. Which IOL is best? Doctor, which IOL is best? So I tell them that if you go to a restaurant and you choose black dal or yellow dal, you know which is best because you've tasted both. But here, first of all, I tell them about monofocal and multifocal. So that argument is, you want to wear glasses, you don't want to wear glasses type of thing. After that, they ask me which brand and all that. So 95% of my patients don't know which brand of lens I'm putting in till they get the sticker. So I tell them that you leave that decision to me because you are not the expert. Unlike the black dal, yellow dal, I am the expert who will decide what is best for your eye and I will put it in. So in my mind is his budget. I'm going to play with the budget. I've told him a particular budget. He says, no, I've reduced it by 20,000 rupees. In my mind, I've downgraded his lens. But that's not discussed with him. I'm not giving him package A, B, C, D, E to choose from because he cannot choose. How does he choose between the two? He doesn't know what is aspheric and all that. It's too difficult even for a counselor to explain. So I tell them, you leave it to me, and usually they do. You will use drops anesthesia only. Now the problem, unfortunately, I'm again white bearded. I use only peribulbous. So I get this question. You will use, because they know that somebody down the street uses drops anesthesia. So how do you counter that? Again, with a little bit of humor, I said, if you like, we can definitely do it with drops anesthesia. I have done a few, which is correct. And the only thing is that my blood pressure goes up by about 20 to 30. Your blood pressure will go up. Also, if anything goes wrong during the surgery, I will find it so easy to blame you. You didn't look where I told you to look. I told you to look in the light. Are kya kar rahe? Look in the light. Then I raise the voice. She says, no, I don't want anything like that. So then I said, then you leave the anesthesia to me. Of course, this again works only if you're doing peribulb. If you're doing topical, you simply say yes. So questions can be all types. The answers have to be given with a dash of humor. Never lie to the patient, but use humor to get your point across and tell them exactly what you're planning to do. I'll just move into, just to give you a couple of more examples. So glaucoma patient is non-compliant. It's okay, na, if I miss a drop or two. I said, yeah. Occasionally you don't say good morning to your wife. It's fine. But if on a daily basis you stop talking to her, you get problems. So once in a while you miss a dose, it's understandable. But otherwise, you need to be compliant. Otherwise, it's so easy for me to blame you for your loss of sight. And will I go blind? So unless he's got 0.95 cupping and a absolute small VFA, you can tell them that no, if you continue to be compliant and follow my treatment, come regularly, we'll try and see to it that whatever vision you have, we'll preserve for you. Again, there is no cure. Will surgery for glaucoma result in cataract? Better to tell them, yes, it could. But many things will also result in cataract. You will become older. That also can result in cataract. And so on. Retina, the patient comes to you, why do I have, he's almost blaming you for his diabetic retinopathy. I have been under perfect control since 20 years. Why do I have diabetic retinopathy? So you tell them that these things, if you were not under perfect control, you would have got the diabetic retinopathy in 10 years. You've pulled on for 20, which is fantastic. But almost, as you grow older, almost everyone will get this. So you need to keep explaining that these capsules, if you're in the habit of prescribing antioxidants, they ask me, will these capsules cure the age-related macular degeneration? I said, no, but it will help the pharma industry. So it's important that you need to help the pharma industry. And they laugh about it. They laugh with me. But then they take the capsules, which I prescribe for them. I said, okay, it's everyone needs to make money. I am making my money already. You paid me. Now you need to pay the pharma industry. So is there any treatment in Ayurveda or homeopathy for the retinitis pigmentosa? So I tell them always, it's qualified that I have been trained in allopathy. I know that in allopathy there is no treatment. And we have very rigorous evidence-based medicine. This is not there in other specialties. So they make a lot of claims. You're most welcome to go to them, but do come back to me after 6 months so I can tell you that it's not working. So then they have that smile on the face because I've conveyed to them that is humbug, but without denigrating the other profession. And how, again, why is retinal detachment surgery urgent? So I tell them that's because my the EMI on my operating surgery equipment, the bank is asking me for that money, so I need to operate you by today evening. So then there's already that laugh and that smile, because obviously I've told them an untruth. Then I tell them that the actual reason is because of this, that you might lose your eyesight and so on. So don't counter with little humor, which is subtle, and then go on to say whatever you want to say. So for lack of time, we'll stop at this. But the idea, just to convey that, don't be serious, even though their disease is serious. You be a little light, but convey everything, and don't lie to patients. Be as close to the truth as possible, but use humor to your advantage. It'll only keep you in good connect with the patients, and they will bring patients to you again. Thank you so much.